Welcome back to the Deep Dive. Today we're plunging into a topic that, well, it's surprisingly common, but often kind of shrouded in misunderstanding. We're talking about Klinefelter syndrome. Our mission today really is to sift through all this research, these notes we have, and just unpack what truly matters about this genetic condition. We want to give you the clearest, most, comprehensive understanding we can.
And we do have a fantastic stack of material here. It's a condition that, despite affecting quite a few people, it very often goes undiagnosed. So this deep dive isn't just about listing facts, is it? It's more about revealing those subtleties, those little nuances that can lead to real aha moments. It really shows you that intricate dance between genetics and, well, human development.
Okay, yeah, let's unpack this then to really get Klinefelter syndrome, or KS. Let's call it KS. We need to go right back to the basics, the genetic blueprint. So what does KS fundamentally change? And I guess, why is understanding that so critical?
Okay, so at its core, Klinefelter syndrome, it's a genetic condition, right, affecting males. It happens when a boy is born with one or more extra X chromosomes. The most common form you hear about is 47,000 XXY. So think of it like this. The typical male blueprint is 46 chromosomes, 1X, 1Y. But with KS, they have an extra X, so XXY.
That's a really vital distinction. And crucially, while it is genetic, it's not usually inherited from a parent, not like, cystic fibrosis or something. It's generally a random event, a sort of tiny, spontaneous glitch right at the start of development, that extra X chromosome. It usually pops up because of an error when cells divide. It's a process called non-disjunction. Now, this error, it can happen when the egg or sperm are forming, or maybe even right after conception in early development. And while 47,000 XXY is definitely the most common, there are variations. Things like mosaicism, where someone might have a mix of cells, some normal XY, some XXY, and then even rarer, you get more severe forms with like even more extra X's, 48,000 XXY or 49,000 XXXXY. And each of those tends to bring a slightly different, often more complex set of challenges.
Wow. Okay, that genetic mechanism, it is complex.
Yeah.
And what's really striking then is how often this happens. It makes you wonder, if it's that common, why don't we hear about it more?
Right.
I mean, here's a really startling fact from the sources. KS affects maybe 1 in 500 to 1 in 1,000 live male births. That makes it one of the most common chromosomal disorders in males. But like you said, despite that, it's often hidden and frequently goes undiagnosed for years, maybe even a lifetime.
And that really hits on a major, well, a blind spot maybe in healthcare awareness. It's not just a number, is it? It means potentially countless people are dealing with challenges without actually knowing the root cause. This underdiagnosis, it really highlights why getting a full understanding is so important. Because early detection, early intervention, it can make a huge difference in outcomes for people with KS. It just underscores how vital it is for doctors, families, everyone to be aware.
Right. And those challenges you mentioned, they can really cover a wide range. The signs, the features of KS, they vary so much in severity. It can be almost like a whisper in early childhood, maybe getting a bit louder later on. What might someone actually, notice as a child is growing up? Well, at birth or in very early childhood, a boy with KS might seem completely typical. Or maybe they're just very mild differences, like slightly smaller tests, perhaps. Sometimes you might also see some delayed motor development, taking a bit longer to sit up or walk or start talking.
Yeah, and then moving into childhood, kids with KS are often taller than their peers. Frequently, they have, long legs, long arms, but maybe a relatively shorter torso. The more significant features, those tend to become more obvious around puberty and into adulthood. Things like small, firm tests, the medical term is testicular atrophy, and gynecomastia, which is breast tissue development in males. You might also see less facial and body hair, maybe decreased muscle mass compared to peers, sometimes narrow shoulders, broader hips, and a really big one. In most cases, it leads to infertility. That's usually due to azoospermia, which means essentially no sperm production.
And thinking about those physical changes, hormones are obviously a key player here. What's going on hormonally, especially with testosterone?
That's absolutely critical. The fundamental issue is often something called hypogonadism, which, put simply, just means much lower testosterone production than usual. And this low testosterone, it sets off a whole cascade of effects. So without treatment, puberty might be delayed, or it might not fully complete. In some adults, it can lead to low libido, maybe erectile dysfunction, and all of this really stems from that impaired sperm production, that azoospermia we just talked about.
Okay, but it's not just the physical side, is it? What about cognitive aspects, behavior? Our notes say overall intelligence is generally normal, but there can be some specific challenges.
Yes, absolutely. It's not about overall IQ usually, but the challenges often show up as, say, delays in speech and language development, sometimes difficulties with reading and writing, things that might look like dyslexia, and also trouble with what we call executive function, stuff like planning, staying organized, prioritizing tasks. Personality-wise, some individuals with KS might be described as a bit shy or reserved, maybe experience some social anxiety.
So it really is a broad spectrum of potential impacts. And beyond those immediate symptoms, are there also longer-term health risks associated with KS?
That's a very important point for managing health over a lifetime, yes. Individuals with KS do have a higher risk for certain conditions. Osteoporosis, for example, often linked to that low testosterone. They're also at increased risk for metabolic syndrome and type 2 diabetes. Cardiovascular disease risk is higher too. We also see autoimmune disorders like lupus or rheumatoid arthritis cropping up more often. And though it's still rare overall in men, there is a slightly increased risk of breast cancer compared to XY males.
So given this huge range of features, some subtle, some not,
Yeah.
how is a diagnosis actually made? We said it's often missed early, but it can be diagnosed at different points in life, right?
Exactly. The definitive way to confirm KS is with a karyotype analysis. That's basically a chromosome test. It looks at the chromosomes and confirms that XXY pattern. That's usually done after birth. But it can actually be detected before birth, too. Through prenatal tests like CVS or amniocentesis, though usually only if there's another reason to do those tests. Postnatally, besides the karyotype, doctors often run hormone tests. These typically show low testosterone, as we discussed, but also high levels of other hormones called FSH and LH, follicle-stimulating hormone, and luteinizing hormone. And for adults, particularly if fertility is a concern, a semen analysis is common, and that often confirms the azoospermia, the absence of sperm.
Okay, it sounds like a complex picture, and I imagine potentially quite overwhelming for individuals and families getting that diagnosis. Is there a silver lining here? What does the research say about managing the condition? Is there hope?
Oh, absolutely. That's a crucial message. There is significant hope. While we don't have a cure, like we can't remove the extra chromosome, the real game changer is early intervention. It massively improves outcomes. The cornerstone of treatment is testosterone replacement therapy, TRT. This is usually started around the time puberty would normally begin. Its goals are to promote those male secondary sexual characteristics, deeper voice, hair growth, muscle development. It also helps increase muscle mass, improve bone density, and can really boost mood and energy levels. And yeah, it's generally a lifelong treatment.
Okay, and what about fertility? That's often a really sensitive area.
It is. And yes, most men with KS are infertile because of the azoospermia. However, and this is a big however, advances in fertility treatments have really opened up possibilities. Specifically, something called testicular sperm extraction, or TEAS, that can sometimes retrieve small amounts of sperm directly from the testes. Then, using ICSI intracytoplasmic sperm injection with IVF, biological fatherhood can sometimes be achieved. This seems to be perhaps more successful in mosaic cases where there are some XY cells. It's definitely not a guarantee, but it provides an option, a chance that just wasn't there not too long ago.
That's incredible. It really sounds like the focus is on comprehensive, sort of holistic support for the whole person.
Exactly right. It's not just about hormones or fertility. Educational and speech support are often vital. Speech and language therapy for those communication difficulties we mentioned earlier, and educational support in school to help manage any learning challenges. Psychological support to counseling therapy can be incredibly helpful for building self-esteem, developing social skills, coping with the diagnosis. And then, of course, managing those associated health risks is key. That means regular bone density scans, keeping an eye on cardiovascular health, blood sugar checks, and yes, even breast self-exams or clinical exams for that small cancer risk. It's about ongoing proactive care.
So putting all that together, the TRT, the potential fertility options, the support systems, managing health risks, what's the overall outlook, the prognosis for someone living with Klinefelter syndrome?
With the right treatment, started early enough, and with consistent, comprehensive management. The life expectancy for individuals with KS is actually very close to normal, and the benefits of getting that diagnosis early are just profound. It leads to much better physical development through puberty, significantly improved social functioning and academic performance, and it really lowers the risk of those long-term complications, the osteoporosis, the metabolic problems. It genuinely can transform the trajectory of someone's life.
So wrapping this up, what does this all mean for you listening? We've kind of journeyed through the complexities of Klinefelter syndrome. We've looked at its genetic roots, how surprisingly common it is, yet often missed. We've seen its wide spectrum of impacts: physical, cognitive, reproductive. It's clearly a condition with sometimes subtle beginnings, but potentially far-reaching effects. And yet the overwhelming message seems to be that it's profoundly manageable with understanding, and especially with early proactive intervention.
Absolutely. And what I find truly fascinating here It's how understanding a condition like Klinefelter syndrome, it doesn't just help the people directly affected.
Right.
It also really deepens our appreciation for just how delicate the balance of our biology is. And it makes you wonder, it raises this important question: what other, maybe hidden genetic variations might be subtly shaping human experiences all around us? Variations that are largely unacknowledged just because, well, maybe our collective awareness hasn't quite caught up yet.
That's a powerful thought. It really prompts you to consider the wider societal impact of simply increasing awareness, maybe improving genetic screening. How just a little bit more knowledge shared and understood can translate into so much support and genuinely improve the quality of life for so many people. Definitely keep exploring that intricate, fascinating world within us.